So diseases amongst men are rarely spoken about, but research has shown about 5% of men that are 40 years old have complete erectile dysfunction, and that the number will increase to about 15% of men at the age of 70. Joining us on the show is a sex therapist, Dr. Oluranti Adekunle. Welcome to the show, sir.
Thank you for having me.
As an agbalagba like you, it's difficult to say that you do this kind of work, but it's all good. You can call us on 070-806-6801. You can also tweet to us at TVC Connect. Please hashtag your TVC so we can read your tweets. All right, so some men, I mean, I was already accused of saying, how can you say a lot of men? So I just say some men have issues of erectile dysfunction. Yeah. And it's something we don't usually talk about in this part of the world because it's embarrassing. Rather the woman take responsibility. It is harsh, it's the problem. But they never want to own up to this. And the idea that you have to go under the knife to resolve this or you have to take medications, a lot of people have that issue. So could you tell us, for those who have no idea, what is erectile dysfunction and how can it be treated?
Okay.
What causes it?
Yes, let me start on this program. I would rather talk on impotence because impotence is what those listening to us and watching us will understand.
Impotence is too condescending somehow.
Impotence and erectile dysfunction, they are the same thing.
Okay.
So I want them to follow.
Okay.
So when we are talking about impotence, is one repeated inability to keep or have an erection firm enough for sexual intercourse.
Right.
It could be total inability, that is the erection is not coming up at all. Is inconsistent ability to have a firm erection, or a tendency to have an erection for a short period. So and there's a timeline for this in sexual medicine. It's about 6 months. So let me say here, there's a difference between erectile dysfunction and premature ejaculation. People tend to miss those two.
Okay.
They are two different things, and the treatment they are different.
What causes the premature expression?
Premature ejaculation is that it's just that erection is strong enough, but the man comes too early. So it's a lot of causes. Yes. So
40 seconds.
Yes. So they are two different things entirely. Erectile dysfunction and premature ejaculation, they are two different things.
Okay.
So when we are talking about the causes, so the causes could be in two broad ways, the organic and inorganic. Okay, when you are talking of inorganic, that is not related to health issues. So you have stress, anxiety, depression, feeling of guilt, that one could affect, relationship, that one is there. When you are not talking of organic causes, you are talking of health-related issues. In that case, you have some medical problems. The medical problems we talk about mostly, one is diabetic patients. Most diabetic patients have this problem. Hypertension is an issue in erectile dysfunction. And then some cases of heart disease, cardiovascular problems, could have
How about weight? Is weight a problem?
No, I'll come to that. Those are risk factors. We go to risk factors. I'm talking about the causes there. So when you have then patients who have had some surgeries, like after radical prostatectomy, following surgery of cancer of the prostate, the nerves are damaged. So, yes, so they could end up with erectile dysfunction. Then spinal cord injury, they could end up with,
Let's talk about the social factors, because when a man feels he's unable to get it up, and it obviously causes issues in the family, and the fact that everybody is just silent about it. The wife knows, the husband knows, and we just mute. Now, how do you, as a family, come to that point where they accept to admit the situation and they can find a way to see a doctor? Because how do you even start a conversation in the house?
Oh, there's nothing to it. There's no myth around it. The truth is that if a man has erectile dysfunction, the self-esteem of a man is no more there.
You feel like he's not a man.
Yeah,
so what can a woman do to help him?
So the woman has to be very, very supportive at that point in time. Because once the woman distances herself from him, it becomes a vicious cycle. Depression comes in, it becomes worse. So the two of them, the couple, they need to come together. Then they see a physician from there because we talk about the different modalities of therapy.
Right.
But if couples don't talk, because it's maybe hard for a man to talk to a wife, do men, in your own experience, do men come to men? Do they come to you and say to you, this is what I'm going through?
But the truth of the matter is that men come alone for the therapy. Occasionally, you see their wives coming along with them. Okay. You know, and at times you see some men, even when they are going through the therapy, they don't even tell their wives that they are going through the therapy.
Right.
They want to see the results.
Yes.
So with the excitement, then they can now say, okay, yes, I'm back in form. so that's it. So
you're saying it's curable then?
it's curable. With the new therapy. We talk about that. It's curable.
Okay.
It's curable.
Is it a common, because yes, the statistics say over 40 and then 70, but is it possible to have it in more younger men? And even if a person is impotent, is it possible for that person to get a woman pregnant? I need to understand
Yeah. You see, to start with, the statistics that Mariah gave, it's okay. We don't have figures in Nigeria, but outside the country, it's believed that 50% of men have erectile dysfunction at one point or the other.
Okay.
So that is there. Then talking about the age, I can tell you we have treated a young man of 24. It's affecting young families,
What
young
can
homes.
cause it for a
Because
younger
it's in a
man?
young person, yes.
Yes, the social effects, you know, lifestyle, you smoke, you
Any
drink
childhood
heavily.
accident that can cause it?
If it affects the pelvis, you are right. But when we talk about the therapy,
Yes.
there are different therapies for each one. So we talk
So,
about that one at a time.
It's a personal issue for many people, and so it rarely gets discussed.
It is.
But we have this platform now, and I've had a case where a lady thought that her husband was just like, I don't know what I did wrong, but he's just not touching me, and didn't know there was any medical issue. And at what point should a woman get worried when there is no touching taking place, or there is no there's no sign, you know, like if at what point, you know, you
Where
said 6 months.
They
intimacy
tell us what to
stops.
do before marriage. We now marriage finished now. So at what point do
Okay,
you
so there
know
are two
there's a
sides.
problem?
How can somebody know
Yeah.
if your spouse has erectile dysfunction before marriage where you're not supposed to be doing anything? And two, if you are married and there is an issue, you don't know. How can you, what are the signs a woman can use to know that I think this man has a medical problem?
It's a problem in Tokyo.
It's easy. You know, the only way a woman can know whether the man has erectile dysfunction is when there is performance or there's no performance. So there's no other way you can know.
What if he says he's not in the mood for performance? What can that woman do to know that if he's medical or not medical?
Okay, the truth of the matter is that if a man is married to a woman, right, normally they stay together, there should be, you know,
Should have known him long enough to be able
there
to
should
tell.
be that relationship.
No,
between
but
the
you
two
know
of
that
them.
question now. You know that how
Some people say that every man should have early. Maybe I should, so that I can get the answer. Early morning erection. So
Very
that if
good.
there is none of that, should you get worried when you don't see that?
That is a very, very good question. You see, that is the self-esteem of a man, because that is during the therapy, which I will talk about. That thing comes back. Okay. If you don't have it,
then you should be worried.
You should be worried.
So a woman should be looking out for that early morning.
But you might not. It might not even be.
Not as a woman.
You see, the truth of the matter is that erection, what you are talking about early morning, it could be very. It could come in the midnight, early morning, anytime. But the man himself will know.
Okay.
It's the man himself that will know. The woman will not be watching.
So this early morning,
wait now.
this early morning
People are worried.
erection. I've started checking my child. I have a 7-year-old. My husband finds it very irritating. But I remember my mom doing it with my brother. And sometimes you ask,
about that one.
no, because we hear all these sort of stories. You missed it when he was a child, you know. So I want to be prepared.
No.
Okay, so
Okay, let's look at
Okay.
it. Okay. Therapy. Tell us, because we know the issues. Families are going through the problem. Is there a solution? Because many people don't want to take medication because they feel that it might affect other things. How do we resolve, or how do we, what's what I'm looking
What are
for?
the possible cures?
What are the ways you can cure this issue of erectile dysfunction?
If you are talking about ways of curing,
Yes.
there is just one new therapy
Okay.
that addresses the cause of erectile dysfunction. But if you are talking about the treatment, general treatment. You have the drugs, you have the vacuum pumps, you have the implants, prosthetics.
Okay.
Those ones are there.
Implant prosthetics.
Yes, yes. You see, that one is surgery. But let me now talk on the one, since you asked that question, the therapy that addresses the cause. At the end of the day, it cures, at least, is the one because, but however, it's not for every case of erectile dysfunction.
Okay.
So you need to see the physician, you are profiled, they know the cause of the erectile dysfunction. That particular therapy is called extracorporeal shockwave therapy.
Okay.
So it's no pain, no drug, no surgery. No
Yeah, but you
anesthesia.
see, I know I read up a bit on this shockwave therapy, and
very good.
I said that I saw online that it's not FDA approved, and there's a fear that it's still in the early stages of testing. That a lot of physicians are just taking advantage of this new technology, and you trying to use it to get people to subscribe to it, and they're really worried that it might not actually be because of the long-term effects.
No, let me say something. For you to get FDA approved in the United States, it takes a very, very long time.
Right.
It has a CE approval. So, but the thing is that, like, since you have brought up that issue,
Right.
in Nigeria, a study has been carried out in University College Hospital in Ibadan. So, and it's been proven that it's efficacious.
Okay.
So yes, it
So
is.
it works.
It works. What it does is that, aside from the other modes of therapy, what it does is that it creates new blood vessels. It creates new blood vessels. So it addresses the problems. So it's not that for every case of impotence or erectile dysfunction, that
So are you able to tell what the success rate is?
the success rate in Nigeria is about 90%.
I want us to answer that question properly. Let me take our call. Shagun, are you there? Hello, Shagun, are you still there?
Yeah, I'm still here. Good
Morning. Go ahead, please.
Good morning, Mariah. How are you?
Morning.
Very good.
And good morning, Dr. Adekunle.
Good
How are
morning.
you?
Well, I'm good.
I don't know why Dr. and the rest of you were laughing when they got on this topic. Yeah, I'm here. Okay, so the question I want him to address is the age, when we were talking about between the age of 40 and 70, regarding to the quick ejaculation or whatever, to deliberate more on that. But I don't know why Dr. was laughing when they started the talk. So just laughing, giggling underneath. Well, that's what I want to
The question is, do you want to get the age range?
Yes, the age, we're talking about from 40s.
Okay,
70s,
so based on what we read, I would like you to tell us exactly what the right age, what age should we start worrying about erectile dysfunction?
The truth of the matter is, by WHO standard, when you talk of a man, 18 years,
Okay.
and I said that 50% of men, that is, you can have it under 20. You've seen it in a man of 24 who is just going for his youth service.
Wow.
But the truth of the matter is, it occurs more in older men, because the reason being that the integrity of the blood vessels gets affected as the man gets older.
Okay.
So that is why you have it more in older men. Because of lifestyle attitude,
Yes.
you can have it in younger men. And you have men who are under 40, a lot of patients, you see them newly married, who have come for this therapy.
Okay, let me take one more call. I'll come to Miriam. Akpos, are you still there?
Yeah, I'm still here.
Thanks for calling. Go ahead, please.
Yes, I need your help concerning of the minimum wage that our president approved. I
Minimum
want to
wage.
know the real point of it. Is it for only federal or both the federal and state?
Across board,
That cross-board for all.
federal and
The
state.
minimum wage.
Yeah.
Yes. Everybody. Okay, thank you very much. Yes, Mariam.
Okay, I wanted to talk about the lifestyle issues that you spoke about. I've heard stories that young people use some drugs, some enhancement drugs, and that they start quite early in their 20s for some of them, and then when they get to their 30s or 40s, they begin to have issues with things like this. Is it true?
That's true. You see, those drugs have their side effects. It's not something that you advise people to use. You see, the thing is that even as at that age, you've exposed yourself to that kind of therapy. You get addicted to it. So, and at a point in time, those drugs fail.
The body gets used to it.
So those drugs fail. So at the end of the day, you end up having
So,
erectile
young
dysfunction.
men need to
Let me
know
just call
this.
for Sandra. Come to Nima. Sandra, are you there? From Abuja.
Yeah, good morning.
Morning. Go ahead, please.
Yeah, please, I want to ask questions in the erection thing that doctor is talking about. Now, I have a friend. He has a good erection, but he comes quickly. Actually, my fiance, he comes on time. So, and it's bothersome. You know, sorry we are doing it, but you know, I'm just worried about it.
Yeah.
I'm worried for him. Though he said he has diabetes.
person do? Right.
He opened up to me that he has diabetes.
Right.
That's what it's causing it. But I didn't believe him. I was thinking maybe there's something more than that.
Okay. So can that...
Now watching doctor talking, watching everybody talking,
Right.
I decided to call.
Thank you very much,
Find
Sarah.
out if really
Sandra.
diabetes.
Fantastic. So can the therapy work for her fiance?
No, you see, what she just described is premature ejaculation. But at times, it's difficult to differentiate to the patient between erectile dysfunction and premature ejaculation. Because the erection might not be strong enough to start with, then you come too quickly. That's it. Because you cannot keep it for long, so you come too quickly.
So that
but if it is strong, very strong, and you come too quickly, then you know it is premature ejaculation. For this purpose, I would advise you see the physician, so that from
Would
there...
they have fertility issues if with premature?
No. They don't. You see, what we are talking about, it has nothing to do with the quality of semen.
Okay.
So what we are talking about now
It's the pleasure part.
So it has nothing to do with the quality of semen. So they are different.
All right.
cases.
I worry when you talk about young people using drugs, sex enhancing drugs. But you know, they now come under a local name with it. And you believe that you're taking herbs. You don't know exactly whether they've been herbs mixed with these drugs. What exactly is the risk of, are there herbs for sexual enhancement? And if there are, what exactly is the risk for them?
For one thing, to answer your question, I will not be able to answer whether they're herbs for...
So they are not.
So I will not be able to answer because that's not my... but the truth of the matter is that most of these drugs have negative effects on the organs of the body, mainly the kidneys and the liver. So it's not advisable that people should just take drugs anyhow without seeing a physician. But like I said, this new therapy, it's no drugs, no surgery.
90%.
Yes. The publication will come out this year.
Let me take this call. Very good. Hello, are you there?
Yes, good morning.
Barakat, thanks for calling. Go ahead, please.
Yes, my contribution is on the other topic.
Okay. It's your view, let it come.
The issue of a health system.
Hello?
Hello?
Yes, we can hear you. Go ahead.
I said until our leaders stop going abroad, that is the time that we can tackle health issue in Nigeria. Without that, there are civic problems.
Thank you very much, Barakat. Thank you very much, Barakat. There wasn't tweets on this issue.
Yes, so Eki says, it's possible in younger men. I experienced it in my 30s when I stopped eating onions. And when the problem was only fixed when I started eating onions. What's the relationship between what
Is there a relationship?
and erectile dysfunction?
Yes, that's a very good thing. You know, part of the therapies is having a good, healthy lifestyle. You take a lot of vegetables, you avoid cholesterol, you know, it helps.
Okay.
It reduces the cholesterol level. You know, when you take vegetables, fruits, it helps. Apart from drugs, you can help yourself with diet.
I know somebody, sir. She's somebody that I know. She's married to somebody who is in the 60s.
Okay.
And she's a young lady. She's practically just started her life. She's in her mid-30s.
Okay.
And one of her issues is this issue of inability for Baba to get it up. And I mean, she didn't confide in me. She told somebody who told me, you know. But the thing is that, so in that kind of situation, so there are men in their 60s, 50s right now who feel as if, I'm going to lie that
it's over.
It's over for me. I can't enjoy a good experience. Are you telling a 60-year-old man or 75-year-old man right now that they can still get it up with this therapy?
I can say in Nigeria, we've treated a man 86. 86.
What's that man looking for?
86.
You know,
86.
Please,
86.
he's looking for life.
86.
86 years.
If he's
So
alive, he
many,
must
there's-
live.
you see, the thing is that, like I said earlier on, it's not for everybody. When you see the patient, you profile the patient, you know those ones that will benefit from the therapy. So, like the patient you talked about, he needs to see the physician.
Right.
Then we know what the problem is, because there might be some other issues.
But are
Those
there
issues-
lifestyle changes or
Modifications.
things that they can do that may help at that age?
The
People
most
that
important,
work out, people that exercise
the
a
most
lot.
important thing is this. Even
And
if you
eat
work
well.
out, you eat well, it doesn't mean that you will not have this kind of problem.
Okay, let me take.
So when we now see the physician, we now know whether we benefit from this.
All right, let me take. Kenny, are you there?
Yeah, good morning.
Morning. Thanks for calling.
Yeah, good morning, doctor.
Good morning. Good morning.
Please, on a quick note, I want to know if
Ekene.
being very sexually active on the early age, can it affect your sexual life at the later age? Can it lead to this erectile
If you're
dysfunction while you are maybe 50, 60?
Okay, what are you saying? That if
The
you're
time you
not,
start, does it affect how long
No,
you
no,
last?
no, 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 no. It has nothing to do with
So
it.
even if a man remains
A virgin up until his 30s.
40,
Yeah, no.
It doesn't mean-
No, it doesn't mean at all.
and if he starts very early,
It doesn't mean.
You know what? I'm happy that he brought this up, because I think there's some myths that they tell young people.
that you
So
should
we
start
hear
early.
young people. That's why we hear young people taking these sexual enhancing drugs. So we hear that if you're a virgin for too long, you may not be able to.
That's not true.
No, so it's
That's
good
not
to
true.
be able to
That's
address
not
that.
true. That's not true.
Okay, we have to go on a break, but and I think we're going to round up this conversation. But generally, the objective was to let Nigerians know there is a solution,
There's a
but it's not for
solution.
everybody.
It's not for
so you need to see a doctor to know if you are eligible for a shockwave therapy,
therapy, yes.
which is something. So I think I'm sure lots of people would probably want to contact. We'll let them know on our own individual pages. We'll share your numbers with them, so just in case they want to see you to get more information on this. Thank you very much, sir, for coming on the show.
It's my pleasure. Thank you very much.